Now at 6, we could see a decision this week from Governor Mike DeWine on the state's controversial transgender bill.
Yeah, he has to choose whether to sign it or veto it. TV's Carly Dion live tonight from the State House with more on where this bill currently stands. Carly.
Andrew, Yolanda, the state's House and Senate cleared House Bill 68 last Wednesday. It's called the SAFE Act, or the Save Adolescents from Experimentation Act. And over the last 2 years, more than 20 states have enacted laws restricting or banning gender-affirming treatments.
House Bill 68 is a horrendous attack on healthcare access.
Dr. Rhea Debussy is the Director of External Affairs for Equitas Health, a nonprofit community health center in Ohio. It provides gender-affirming care to adults, among other services. Dr. Debussy fears the passing of this bill will harm transgender youth throughout the state.
HB 68 will adversely impact them and directly target them in very specific ways.
Debussy says it will remove access to existing medical care for transgender youth, which, according to the Ohio Children's Hospital Association, will also restrict how medical professionals can talk to patients and their families, as well as providing medication therapy to new patients. However, any minor currently receiving this type of care would be allowed to see it through.
This bill is going to remove access to things like puberty blockers, which are still going to be available for cisgender youth. It's going to remove access to mental health services, which are also going to still be available and accessible for cisgender youth.
If the bill passes, the mental health services and counseling for transgender youth would require parental consent. The SAFE Act also blocks transgender student athletes from participating in girls' and women's sports. Supporters of the bill, like Senate President Matt Huffman, say it's about protecting children because they cannot provide informed consent for gender-affirming care.
Certainly the parents are the most important decision maker in a child's life, but there are things where it's important for the state to step in.
Now it's up to Governor DeWine, who has 10 days to make a decision on the bill from when he physically receives it. While visiting the Urban Community School in Cleveland today, DeWine says he'll be focusing on the bill over the next few days. DeWine says it's an important issue where people feel strongly on both sides.
The one thing that I think is clear to me is both sides, frankly, want what is best for children.
And Governor DeWine adds that his decision will ultimately be based on what he thinks is in the best interest of the children who will be impacted by this. Live at the State House, Carly Dion, 10 TV News.